Hello, I'm Matthew Weinstock with Hospitals and Health Networks. Earlier this month, we launched the 16th Annual Most Wired Survey. This is our annual assessment of how hospitals and health systems are implementing information technology across their organizations. Right now, I'm joined by Susanna Hopsalern, our Senior Editor for Research and Data, who really manages that process. We're going to talk a little bit about what changes we're seeing in the survey going forward this year. Susanna, thanks for being with me.
Thank you, Matthew.
So Susanna, as I said, we're in the 16th year of the Most Wired Survey. It's pretty exciting to have done it for this long. As you look at the survey over that course of time, what stands out to you most?
Probably the piece that's most exciting is the development of patient engagement. And we're seeing now more than ever multiple offerings to really connect to the patient, whether it's through secure email, a patient portal, a kiosk, or mobile devices. And this year we've really beefed up the section on mobile applications because a lot of patients and families might not have access to a computer, but they do have a smartphone, and this is becoming their device of choice. So we're looking at self-serve through any of those venues, and it could be for making appointments, tracking their health, getting feedback from their clinicians, keeping track of medications. So
as we look at the 2014 survey, you seem to have added a few questions that look at maybe internal accountability or how we're really measuring whether or not hospitals and health systems are implementing some of the changes in technology. Can you talk about that?
One of the areas that we're really looking at now is the feedback to clinicians, clinician leaders, and physicians. So in the past, some of the quality measures that we were tracking may have been done on a monthly basis or an annual basis, but we decided when you're in this type of an environment and you're wanting to make changes rapidly to the patient's care, you may want to give that type of information to clinicians on a more frequent basis. So this year we're introducing some new metrics around there about improving quality through health information technology.
We also know that the upgrades that hospitals have to make in their IT systems are coming fast and furious these days, and there are some new measures in the survey around that aspect too. Can you talk a little about those?
Hospitals are very challenged with so many moving pieces in health information technology. With so much on their plate, it's important to have a very tight governance process that really looks at all of the stakeholders, the clinicians, the health system and hospital leadership, the IT staff, and the vendors, in making sure that the project is clearly defined, that the measures are there, and that there is a time to evaluate what the outcomes are, and really even leaving time for re-engineering of processes to make sure that it's going to work. We also added a question related to health information technology event management, because there can be safety issues if these technologies are not deployed in the proper fashion. So that's the other thing, that we want to put some safeguards in there and make sure that not only is the process smooth, but it's safe.
And also over the past couple of years, the Most Wired Survey has really incorporated some meaningful use measures. So as we move into stage 2 and 3 of that regulation, how do you expect the Most Wired Survey to evolve?
We have incorporated some of the leading measures for stage 2 and stage 3, particularly regarding the patient portal and connectivity among providers, the communication links. But we're also looking beyond that in terms of how are hospitals and health systems preparing themselves for new care delivery models. So really last year we started with some increased focus on analytics, and we beefed up that section. We've seen some progress there, but there are some new avenues in which hospitals really need to make progress for that total community care record and to be able to use that information in a very timely fashion. So this year we actually added population health analytics section to help us with that.
And lastly, Susanna, as you anticipate the surveys coming in over the next couple of months, what are you most looking forward to? What kind of data are you really hoping to sink your teeth into?
I'm very interested in the progress that we're making in the analytics. If we are getting that level of connectivity that we had hoped, we've been seeing progress, but we need to make a lot more progress, and we need more sophistication in sharing the data and analyzing the data to make sure that we're really providing not only quality care, but affordable care. So we have measures in that survey that are looking at all of that functionality, and it'll be interesting to see the progress we've made this year.
Well, great. Thanks, Susanna.
Thank you, Matthew.
And so the Most Wired Survey is open for any hospital or health system to take. It's open until March 15th. You can access it on our website at hhnmag.com or at the Health Forum website at healthforum.com, again, until March 15th. And look for ongoing coverage of Most Wired in every month's issue of H&HN, as well as our annual cover story in the July issue. I'm Matthew Weinstock. Thanks for tuning in.